I now recognize Ms. Dingell from Michigan for 5 minutes of question.
Thank you, Mr. Chairman. Throughout today's hearing, we have repeatedly heard mischaracterization after mischaracterization about public health tools that were designed to keep communities safe, especially the safe and effective COVID-19 vaccines that help save lives. And for all of you, this committee's heard it. There is no one that was more afraid of that vaccine than me. I got Gansbury from a flu shot, and I was scared to death. And you're talking about, I did wash my cereal before I brought it in the house. I wore gloves. There are videos of me cleaning my colleagues' seats. I studied, and I studied, and I studied. And I talked to doctor after doctor after doctor. So I want to hear, having said that, and what I'm really worried about at today's hearing and about everything else, is that what is the right of people when you're in a community setting? I'm going to use measles as an example. We are seeing the outbreak of measles again in communities because people are becoming afraid of having those vaccinations. So what is individual right versus community right? And I think it's becoming more complicated, and these discussions contribute to it. Right now, I want to take a moment to correct the record. When President Biden first unveiled his national strategy for the COVID-19 response and pandemic preparedness in January 2021, more than 3,000 people were dying each day from this virus. At this time, vaccines were the strongest tool we had in our toolbox to prevent more suffering and more death, and they continue to be. It is because of President Biden's steadfast leadership in standing up, which, by the way, I give credit to President Trump. He started it. And then we got it, and we got a vaccine program in our nation's history. We got this, because of President Trump's work, we got this faster than any we've seen. We stood up the fastest successful vaccine program in our nation's history that were able to save another 3 million American lives and prevent another 18 million hospitalizations. And while the success of the COVID-19 vaccine rollout was historic, there are lessons we need to learn from this pandemic that we need to apply for the future public health crisis. But I will also say to you, the primary lesson is how do we ensure people are getting accurate, reliable information so that they can make informed decisions about their health. And over the course of the pandemic, we did see falsehoods about COVID-19 and vaccines flourish online. Misinformation and disinformation. The claims that the vaccine will alter your DNA. By the way, I believed it at first. I went and talked to about 100 people. I got as scared as anybody did. And doctors that were really respected said, Debbie, you're crazy. And I probably was. But I looked at it and make you magnetic. And they also said they make you magnetic. They serve to dissuade. And by the way, I also had a family member that almost died that took hydrochloride, whatever, chlorine. But it dissuaded people from getting vaccines and protecting their health. So, Professor Schwarzman, I'm going to go back to you. I want to get your thoughts. In the United States, freedom of speech is constitutionally protected, right? But does that mean free speech comes without consequences, particularly when it's exercised to recklessly amplify dangerous disinformation, as we saw throughout the COVID-19 pandemic?
No, you have a right to freedom of speech, but of course all rights can be abused, and they're abused in this case through misinformation and disinformation, as you said. The government also has a right to engage in speech of its own, to explain its views, to explain vaccine safety and effectiveness. It can engage in speech, counter speech, to correct that kind of misinformation, and it can communicate that messages to private actors who can engage in moderation of their own.
So there's a May 2022 Brown University study found that the sort of abuse of free speech contributed to approximately 319,000 preventable deaths. To combat the spread of this dangerous misinformation, social media companies maintain their own independent system to verify the types of claims that I mentioned earlier. While these processes are far from perfect, they've had the potential to serve an important role in combating the proliferation of dangerous posts and videos. many of which still slip through the cracks. Professor Schwartzman, the constitutionally protected guarantee of free speech does not apply to private platforms, such as those maintained by social media companies. Is that correct? And I'm out
That's
of time.
correct. Under existing doctrine, social media companies are not state actors who are bound by the First Amendment. They're given protection for content moderation under federal law.
I have more questions I'd like to submit for the record. Thank you, Mr. Chair, and I yield back.